Great. Good morning. My name is Mike Del Trecco. I'm the president and CEO of the Vermont Association of Hospitals and Health Systems. Thank you for joining me today to hear about hospital budgets for the upcoming year. Today, I have with me several representatives from hospitals, and I want to thank them for their leadership and their time today. There's so much to celebrate about Vermont's healthcare delivery system, and I want to start by acknowledging that. We provide tremendous value to our communities. We are places where patients and families go for their care. We're places of hope and healing, and in many ways, we're the economic hub of our communities. Tomorrow, our hospitals will enter into a process of presenting their budgets to the Green Mountain Care Board. But each hospital budget started many months ago, including a detailed and carefully crafted analysis that has taken into consideration community needs, operational efficiencies, health equity, access and quality initiatives for all Vermonters. As the CEO of VAHHS, I'm very proud of this work, as it's never easy to balance these demands, especially when you consider the level of uncertainty our hospitals manage every day. 2 years ago, we were smack dab in the middle of a pandemic. And just about a month ago, we were dealing with impacts of flooding that devastated so many communities across our state. Beyond these challenges, our hospitals are managing unprecedented inflationary pressures, managing a mental health and long-term care crisis, attacks on our staff that further stress our already challenged workforce, all while trying to meet the demands of a fractured healthcare ecosystem. As I look across the country and talk to my colleagues in other states, one thing that is profoundly different in Vermont is the advancement of value-based care initiatives and the simple but important fact that Vermont hospitals are not for profit. What this means is that we step in, we do the right things for our staff, patients, and our communities, even when the economic realities of the business model don't make sense. We collaborate, we share physicians, we solve transportation issues, we invest in housing, and we rise to the occasion every time there's a need. There are literally countless examples of this happening every day in every one of our hospitals throughout Vermont. Vermont hospitals solve problems for our communities without compromising our mission. I know for certain that this would look a lot different if our goal was to generate profits for shareholders. This is a big deal. The work is exhausting and unpredictable, and we ask that our regulator consider these realities and help us work towards stabilizing our delivery system so we can be strong for the next crisis and the one after that. Very importantly, these budgets are set with only margins or funding required to invest in our caregivers and organizational needs. It's important to remember our hospitals are not starting from a place of financial stability. In fiscal year 22, 9 of our 12 hospitals operated at a loss, and these challenges remain in 2023. Despite these issues, our hospitals continue the complex work of expense management. To limit supply cost growth, they belong to group purchasing organizations. They share physicians and staffing. They use technology where appropriate, and they manage FTE positions daily. But one simple fact that we cannot forget is hospitals must have highly skilled and talented people to care for patients and to make sure that their facilities are safe for patients, family, and staff. There are so many reasons to support our hospitals. Many are obvious. For example, they help bring life into the world. They promote health and wellness. They save lives, and they help people die with dignity and respect. And other reasons are not so obvious, but are no less important. We must have stable hospitals so that they have the resources to support our state partners, to continue on our path of reform, to maintain access to equitable and high quality services, and keep costs in check for Vermonters. I close by saying once again, these budgets are about stabilizing our organizations. So they are here for our families, friends, and neighbors today and well into the future. I ask, as I know they will, the Green Mountain Care Board to continue to recognize the challenges we are managing and the hard work and resources it will take to bring stability to the industry. That our hospitals have committed to a reform process unlike any other state in the country. And finally, that they support these budgets so our hospitals continue with the work of serving Vermonters, that with care that is local, equitable, high quality, and accessible. So again, thanks for being here today. And now I'll turn it over to our first speaker. I'd like to invite Dan Bennett, the CEO of Gifford Medical Center in Randolph and the chair of the Vermont Hospital Association Board, to provide a snapshot of some of the challenges of keeping care local in rural Vermont. Thanks, Dan.
Thank you, Mike. Good morning, and thank you all for joining us. While the topic today is the regulatory budget review process, it's also about the current and future state of Vermont's healthcare system. Every part of Vermont's healthcare system is struggling. We are crawling out of the pandemic and are working to stabilize the system while we make needed investments for the future. We are committed to ensuring that we are here to provide access to healthcare services in our rural communities for many generations to come. At Gifford, our current state includes inflationary cost pressures impacting our supply, food, and energy cost. We have employed strategies to limit these impacts. They include a membership in a group purchasing organization, along with other Vermont and New Hampshire hospitals, and an internal value analysis process to ensure our stewardship of limited resources. Workforce challenges remain throughout Vermont's healthcare system. At Gifford, we instituted a new market-based compensation program over the past 2 years. This investment has improved our ability to retain employees while also significantly increasing our staffing cost. We are investing in our future workforce through our nursing residency and nurse preceptor education programs, our licensed nursing assistant and medical assistant training programs, and by partnering with the Vermont Talent Pipeline. We recently entered into a joint affiliation nurse education partnership with Vermont Technical College's nursing program, in which Gifford will employ a nurse educator to work within the VTC program. It is difficult in the current environment to retain and attract people to fill Vermont's needed healthcare positions, and even harder in our more rural areas like Randolph. But Gifford is making the necessary investments in our people to ensure we have a talented and engaged workforce to meet the needs of our communities. These investments are reflected in our fiscal year 2024 budget and are a key element to Gifford's stability and our ability to provide access to the quality healthcare services our communities deserve. Gifford is also investing in improving the health of our population. This includes not only caring for people when they are sick, but providing resources and assistance to help community members stay healthier and, wherever possible, avoid more costly healthcare services. We have created a value committee at Gifford, a multidisciplinary effort to marry clinical and financial data analysis for the purpose of improving patient outcomes and reducing the cost of care for patients. This committee has focused on areas such as utilization of high-cost imaging and engaging and supporting frequent utilizers of emergency department services. Through our community outreach program, our Gifford team provides support on a wide range of topics, including diabetes care, teen vaping, teen mental health, substance use, advanced care planning, and numerous nutrition topics for families and children of all ages. In addition, we maintain numerous programs designed to combat food insecurity in our communities. We collaborate with the Vermont Food Bank to offer Veggie Van Go. We deliver 200 boxes of food monthly in Chelsea, Tunbridge, Bethel, and Rochester. Our practices distribute food supplied by the Randolph Area Food Shelf to their patients who experience food insecurity. Last year alone, we served more than 9,000 households through these programs. You've heard me use words such as partner and collaborate throughout these comments. This is indicative of our joint work with other organizations every day to address community need. Gifford this year will hold our second annual community listening tours. These meetings are an opportunity for our leaders and our board members to hear directly from our community members about their needs as they identify them. This year, we'll be joined by 3 of our partner organizations, Capstone Community Action, the Clara Martin Center, and Tri-Valley Transit. These particular organizations work with Gifford to address several needs identified in our listening tours last year, including food insecurity, access to mental health services, and transportation to access care, as many in our communities are unable to travel to Burlington or Lebanon for services. We believe that these partnerships are necessary in order to positively impact population health and ensure health equity for the people we serve. Gifford will continue to invest time and resources in these activities. The budget that Gifford Medical Center has submitted to the Green Mountain Care Board reflects the current challenging environment in which we operate. It also reflects the investments we are making to serve the people. It also reflects the investments we are making in our people and in the long-term health of the communities we serve. These investments are key to making our healthcare system more affordable and sustainable. Thank you for listening. Now I'm going to turn it back over to Mike to introduce our next panelist.
Thanks, Dan. You and your organization represent so much of what is important in delivering care to rural Vermont. So I appreciate that perspective. So I'm so thankful to have Dr. Stephen Loeffler, the president of the University of Vermont Medical Center, to provide some insight on what it means to manage both an academic medical center and community hospital in Vermont. So Dr. Loeffler, thank you very much for being here today.
Thank you, Mike. So the UVM Medical Center, like hospitals nationwide and local partners across Vermont, are confronting really difficult financial realities right now in healthcare. Pharmaceutical costs are rapidly increasing. The wages that we need to pay our employees to have a stable workforce to compete with all the other people in our region for healthcare workers and for other physicians has increased, putting huge pressure on our financial sustainability. It's really important right now that the budgets that we build are focused on the services we're trying to provide patients in our region. As Mike said, in Burlington, UVM Medical Center is both a tertiary care hospital for patients across our region. We take sick patients from every hospital in the state of Vermont and upstate New York, but also the local hospital for people who live in Chittenden County, Grand Isle County. We take that responsibility very seriously, and we are focused on being here both for our local patients and for everyone in Vermont who needs us. Many of the challenges you're going to hear from all of our panel today are also happening at UVM Medical Center, just on a slightly larger scale. At the medical center, we provide critical services that are only available in the state of Vermont here. Services like our NICU, level 1 trauma care, and cardiac surgery. We're very proud to offer those services, but they're expensive to run, they're expensive to maintain, and those realities are built into our budget. We've been very, very focused on improving access this year, although that's been very challenging. In the past year, we've been able to make investments in bringing new equipment online, like a second MRI machine and another CT scanner. And we've been running those machines to improve access for patients, but running them by paying overtime and traveler expenses. For many of the services that we provide here, we are relying on travelers right now to make sure that patients have access to that care. That's very expensive. It's the right thing to do for patients, but it adds pressure to our budgets. In terms of other ways that we're improving access right now, we've added a second Da Vinci robot this year, and that's improving access to gynecology care, general surgery, thoracic surgery, and urology. We've made great progress in getting those surgeries done in a more timely fashion. And we're also using e-consults to improve access to our specialists. So many patients now can see their primary care doctor, have an e-consult ordered, and get care that allows them to quickly get on a new treatment regimen without needing to see the specialist in person, really improving that service. The budget that the UVM Medical Center submitted is the budget we believe we need to take care of everyone who needs our services. The budget is built in new programs. We've added a new cancer treatment program called CAR T-cell or chimeric antigen receptor treatments. It's a special treatment for people who have certain kinds of cancer that before this treatment were not curable. This treatment is amazing. We're really proud to have it here in Vermont at the Academic Medical Center. If any of our loved ones had this kind of cancer, you'd want to be able to get it close to home. It requires 8 weeks of treatment. And before we were able to offer it here, people had to travel to Boston or Albany or someplace far away and be away from their family for an extended period of time. It's very expensive to run this program. The drug costs more than $400,000, but it's critically important that we offer this close to home. Programs like that are in this budget. I will finish with saying that in 2022, the Academic Medical Center lost about $23 million. Our expenses were greater than our revenue in 22 by $23 million. And we used our days cash on hand or our rainy day funds to cover that loss. That's not sustainable. Our rainy day funds, our days cash on hand, are meant to be used in critical times. We did that in 22. In 23, I'm proud to tell you the medical center will have a small margin. A margin is different than a profit. Our margin is the dollars that we use to invest in our future, the future of our facilities, so we can be here stronger and better for patients, to bring new treatments online like CAR T-cell. Our margin is used every day for new equipment like MRI machines, Da Vinci robots, to pay our staff well, and to renew our facilities. Our 24 budget is built on the strength of the small margin we have in 23 to help us keep that momentum so we can be strong in the future for both everyone in Chittenden County and Grand Isle County who needs us, and for people across our region who rely on us for tertiary care. Thank you, Mike.
Thanks, Dr. Leffler. I really appreciate the insight on balancing the needs of an academic medical center with the community, local community needs. So thank you so much. Next, I'm pleased to introduce Dr. Trey Dobson. He's the Chief Medical Officer at Southwestern Vermont Medical Center, a great physician leader and resource to my organization. So I thank him for that. He'll be offering some insight on delivering care in a community hospital, as well as managing the perfect storm of some of the challenges you've heard us discuss. Trey, all yours. Thank you.
Thanks, Mike. So, and I think everyone is aware that healthcare personnel of all types have been leaving their careers at a really high rate. I mean, you know, it's difficult in many sectors of business right now, but healthcare for some reason has faced challenges that really exceed our capacity to deliver care at times. It's a stress of overcrowding. And when I say that, I mean overcrowding in offices and hospital settings, and increased in verbal and physical assaults. Yes, even right here in Vermont, in all our hospitals and medical practices. And that leads to this loss of joy in their practice of medicine. You know, I watch as my nursing and physician colleagues come into work, they put one foot in front of the other, and they drown out the noise of the surrounding duress that they see in the hallways and, you know, in the clinics. And they take a deep breath and they focus on why they entered healthcare in the first place. And that's to limit suffering and improve the lives of people in their community, their neighbors, their family and friends, as Dan was referring to earlier, and people who are visiting from faraway places and depend on them to be there. But I watch as that situation slowly eats at them. It eats at their mental capacity, and, you know, frankly, it eats at their souls. As a doctor, my job in the emergency department is to take care of patients. But as chief medical officer, one of my greatest responsibilities is to try to ensure the safety and the well-being of the staff. And that's not just my responsibility, it's the responsibility of myself and my colleagues. And that includes ensuring the well-being of the nurses, the doctors, the techs, the non-clinical workers that make the hospital, the x-ray machines, the pharmacy, the primary care offices function. So we do what we can. We raise awareness, we identify risks, and we listen. And I hear the stories of the limited time they have with patients now compared to in the past. I hear about the hours that they spend charting on a computer after work and at home. And I hear about the increased regulatory burdens and loss of autonomy. These are big problems. I hear about the experience and the anxieties that occur when a patient or a family member becomes agitated and verbally or physically assaults them. It leads them to wonder, why am I enduring these terrifying experiences that I never imagined would happen to me? But their greatest concern when it gets down to it, when I have to sit down discussions with them, their greatest fear is the dread that overtakes them when they do not have the resources to provide standard care for their patients. On any given day in the emergency department, I see 20 to 25 patients. These are not sprained ankles and minor sore throats. These are people with symptoms that reflect potentially severe medical problems. And once a medical problem is identified and treatment has started, I have to ask the question, and often this is quietly to myself, do we have the resources in this hospital to take care of this patient? And unfortunately, that answer far too often is no. So what happens? Well, I spend the next 30 minutes or longer on phone calls trying to get patients transferred, often to a different state based on my location in southwestern Vermont. It's often to New York, Massachusetts, and further south. And the patients and families, they're quite upset. They're often upset with me. They're often upset with the system. They don't want to go elsewhere. They don't want to undergo that travel, that time away from their homes, their families, away from their responsibilities, and not to mention all of the associated excess costs that come with them having to travel to another location. Many of these patients could actually stay here with improved basic coverage in specialties such as urology, gastroenterology, cardiology, psychiatry, and substance use disorder. If our budgets are not approved and we cannot fund routine services, I personally will have to spend even more time trying to find another hospital to take care of that next patient, and so will all of my colleagues. And then we have to try to find an ambulance willing to take them there. And the patients will be in their beds for hours, unfortunately, sometimes days, frustrated, getting care they need, but not where they need to be getting that care. And then my physician colleagues in primary care practices and specialty offices, they will be further challenged to accept new patients and provide the care that keeps those patients from having to come see me in the emergency department in the first place. But here's the ironic thing, and something we don't think about enough, and that is the cost of care for Vermonters actually increases with this model, regardless of where the care is provided, whether that's in our system or an entirely different healthcare system in a different state. The patient, the insurer, and ultimately the public pays for that care. And I can tell you firsthand, that care is less expensive when we keep patients in Vermont. Someone mentioned earlier, Mike or Dan or Steve, that our utilization in Vermont is less. And so we do more for patients with less resources. But when they go elsewhere, the costs actually go up. So, we can't fix everything, and these budgets can't fix everything, but we can provide the basics. We can provide what's reasonable. And to my knowledge, no hospital is asking for anything extravagant. No one is asking about high dollar equipment or treatments whose value is yet to be proven. We are simply asking for the funding to do our job, to do what we were trained to do. And these budgets are necessary to enable healthcare personnel to continue to save lives, to limit suffering, and to heal. So thanks for the time, Mike.
Thank you, Dr. Dobson. I mean, that is an incredible picture of some of the moral injury that your teams are facing and the decisions you have to make. Now I'd like to turn it over to Anna Noonan, president of Central Vermont Medical Center. It's important to know that Anna has a deep background in nursing, and she knows firsthand about caring for patients, specifically around the impact of the pandemic and the recent flooding that has occurred in her area in Central Vermont. So Anna, thanks for being here today, and the floor is yours.
Right, thank you, Mike, and good morning, everyone. Like hospitals nationwide, we continue to confront stark financial realities, especially with the cost of drugs and supplies. We're committed to staying competitive in the market for our most important resource, which is our employees. This has become even more challenging during a national workforce shortage. Our hospital budgets are focused on ensuring financial stability that allows us to meet the needs of individuals seeking life-saving care now and in the future. This is a pivotal year for us. The discussions we have with the Green Mountain Care Board about net patient revenue and commercial rates must go hand in hand with our mission to provide care for our patients and our nursing home residents. These budgets assure access to important healthcare services. 4 weeks ago, our central Vermont community was devastated by torrential rains that caused life-threatening floods and destruction. Our hospital and emergency room were inundated with displaced neighbors who had no place to go. During the early days of our storm response, some of our community members feared they would run out of their life-saving medications and their oxygen supply. They came to CVMC for safety and treatment. Our CVMC staff were also impacted by the storm's flooding and roadway damage. During the early hours of our storm response, some staff stayed at CVMC unable to leave at the end of their shifts or travel to CVMC due to closed roads and dangerously high waters. These storm waters impacted I-89, preventing us from transporting patients north and limiting our supply chain corridor. We've been in crisis and disaster response for years now, and this is just the latest example. As healthcare providers, we train and prepare for disaster response and recovery. Every crisis takes a different form than the last. Our response has a singular focus of assuring that our communities continue to receive the life-saving care and treatment they deserve, no matter what the crisis may be. During this latest event, our team did what they do best. They took care of our community. We set up a system to dispense meds to folks whose homes were flooded. We housed people in our waiting rooms who were worried that they would run out of oxygen. Our staff and providers slept on cots in hallways and in our offices to cover shifts for those who couldn't make it to the hospital. And once the rain stopped and the sun appeared, we headed down the hill and into the streets of our communities to offer medical assistance, muck out basements, and deliver meals. We've been through a lot these last several years, and it seems like the hits keep coming. Yet we always get back up and provide the care our communities deserve. We've seen a lot of selflessness, and it fills us with pride, as it should. I'm a nurse with 42 years of experience. The commitment to our mission drives us to serve every day, no matter what. When I go before the Green Mountain Care Board, there's a lot of talk of numbers. Each of those numbers and budget lines represent our ability to deliver health care for our patients, our nursing home residents, and our communities. We are here every day, whether we're responding to a global pandemic, a devastating storm like the one in July, or by providing preventative care in one of our primary care practices. We are here for our communities every day. We have a lot of work to do at CVMC to continue to strengthen our finances, but the budget we'll be presenting to the Green Mountain Care Board sets a course that will help us get there. And with that, I'm going to return it back to Mike.
Thanks, Anna, and thanks for all the speakers this morning and your insight. Folks, as you've heard, every Vermont hospital is committed to forward progress. We've demonstrated a commitment to our communities like none other. We keep doing the right work at the right time. We participate in value-based care models, manage crisis after crisis. This is not simple work. This is complicated. And you've heard from each one of our speakers today how committed they are through the mission and vision of our organizations. We need support. We need support, and we need to have stable budgets and stable financial future so we can do this work well into the future. Again, I know this work is difficult, and these are needs-based budgets, nothing more. And nothing extra. And I would like to again thank the panelists and my team for being available today. So I'll open it up to questions from the media, and thanks again, everyone.
So feel free to put your questions into the Q&A, or you can raise your hand and I can allow you to speak. Thanks. They go on, Kristen.
Hi, everyone. Kristen Fountain from VT Digger. So I'm reporting today on some insurance rate decisions for the exchange markets. And I'm assuming some of you have seen those decisions, maybe not, but they came out yesterday, late afternoon. So in them, there's an assumption that in aggregate, the hospital budgets will be cut by 50%. What do you think of that?
Kristen, thanks for your question. I'll start by saying, that would be absolutely devastating for our facilities and organizations. Some context to that is, our state is the most rural state in Vermont. We also have some of the oldest population, and our demographics need to have their care local. Those types of reductions, as you mentioned, and I haven't read the details, so I'm not as intimate as you are, again, would be absolutely catastrophic to the care we deliver to our communities. I'll open it up to the panelists to, if they have any thoughts on that, if they've read that information or heard of that information.
Mike, I haven't actually read the report yet, but what I can tell you is that right now the Academic Medical Center is still relying on hundreds of travelers at high expense. We're relying on overtime. We're relying on special pay to make sure we have enough providers here to provide care. And our budget reflects that. There's work to do on our budget, even to get down to the targets that we submitted for the expenses for next year. If our rates don't come in, we'll have to figure out how to reduce those expenses, but that will likely be people, which will limit some of the things that we can do. We'll have to figure out how to do more with less. So concerning.
Thanks, Dr. Leffler. Anyone else? Or are there other questions from the media?
I just want to amplify what Steve just shared. The budgets that every CEO in the state submitted is the budgets that we really think we need to provide the healthcare that our communities deserve. And to Steve's point, there have been incredible inflationary challenges that we've been facing since the global pandemic, but even before then. And so our budgets reflect the dollars that we need to provide those services. We've been very prudent with managing those expenses. I know at CVMC, we've launched a number of initiatives to make sure we're reducing waste in the system wherever we can through a lean initiative. We've had, I think, over 90 projects going in that arena. And still, the cost of delivering healthcare is expensive. It's increasing. So to Mike's point and Dr. Leffler's point, I'd be very concerned if we had a reduction in what we're asking for. It would impact us significantly.
Yeah, and I'll
Dr.
just
Dobson.
echo that. Yes, thank you. I'll just echo and say, and we're not unique here at SVMC. I don't think we can reduce expenses anymore without cutting services, point blank. And when we cut services, that means people will go elsewhere for the care. They need to receive it. And I'll reflect back on what I said earlier. That actually will lead to an increased cost to the state, to Vermonters, to the public for the healthcare. We're not talking about doing neurosurgery in these small hospitals. We're talking about providing basic pulmonary function tests, basic things that people need. And if we have to cut those services, they'll have to go elsewhere, and that again will increase costs overall.
I'll round up by saying, if these sorts of measures are taken, it's certainly, we're working so hard on health equity. This would create such a two-tiered system. It would be highly problematic. We'll move on to Tim McQuiston.
Thanks, Mike. One of the issues that has come up repeatedly are, for lack of a better word, management and executive pay. And I'm sure that the the public looks at the salaries of the healthcare industry, not just the travelers, but the regular full-time employees and the number of management positions. And I've heard it from other healthcare professionals too, that that has to be reduced. Could you respond to that?
Sure. I'll start. This is always an interesting question. The majority of our hospital expenditures go towards salaries, benefits. Executive comp is part of that, and I will tell you unequivocally that it's a small fraction of it. As I mentioned in my remarks, we need highly trained and skilled people to care for patients, and to clean our facilities and keep our facilities safe. That's complicated, and sometimes it's not very efficient. I'll just say it. And as we sort of go into this space of compensation, our executive compensation set by local boards who understand the community issues and balance that with recruitment and retention of highly qualified applicants. These are complex businesses that take a lot of resources to run. I think looking at executive compensation or management is an important part of the conversation, but it is very one-dimensional, and there's more to the eye here, and we need to continue to focus on what our community needs and how that plays out in each organization is different in their assessment in their budgets.
Mike, what I would add is at the UVM Health Network, we strive to pay everyone fair market rates for their position, whether it's entry level or executives. Everyone is on. We work to have a benchmark. And what I can tell you is that over the last 4 to 5 years, more than ever before in my 30-year career, we're in a national market for all of our employees. We're in a national market for our nurses, for our techs, for our doctors, and for our executives. And if we don't have salaries that are competitive nationally, we will not have talented people here in Vermont for any of the positions. It's always tricky to decide at what level you're going to stop paying market value. So what I would say is, Mike already said this, executive compensation is a very small percentage of our budget. And if you paid none of the executives in the UVM Health Network anything next year, it would not solve a budget crisis of a decrease of 50% in the rates to commercial. It would be a small drop in the bucket in that problem. We have to figure out how we're going to compensate people in healthcare under these pressures. The medical center's budget, 80%, more than 80% of our budget is the staff, the people that provide care, up through our leaders, and pharmaceutical costs. That's where the money is spent in healthcare. So I hear the question, I understand it. I will tell you that during the pandemic at the medical center, when we were losing a lot of money, the network did cut executive salaries to help cover that cost. And that'll be on the table again as things go forward if it's necessary. But we do try and pay people competitive rates for every position in the network. Thank you.
Thank you. Any further questions from the media? Tim, did you have another question, or is your hand up from the last?
Oh, no, that was it, Mike. Thank you.
Thank you.
We have a question from Howard.
Go ahead, Howard.
Yeah, I'm wondering what your message is to Vermonters and to groups like the Chamber of Commerce who are, talking about how these budget increases, depending on what you get, lead to higher insurance rates. Everybody is facing inflationary pressures. Is there a point beyond which, Vermonters just are not going to be able to pay these insurance increases? What's your message to those folks who are having trouble paying their insurance premiums and monthly bills?
Thanks, Howard. I'll start by saying I've been doing this a long time, and I remember back in the legislature when we started first talking about caps and the notion how long could we have caps and downward pressure on appropriate growth. Since the inception of the Green Mountain Care Board, our growth has been about 4.5%. In many, many years, that's well below healthcare inflation, which is problematic from what you're talking about. I can tell you some of the challenges that we're dealing with, as Dr. Leffler and others have mentioned, is to open up access. We need staff, and that staff comes from, unfortunately, in this situation, contract labor, which adds some of the inflation to some of the already high inflationary pressures, such as approximately 8% in the pharmaceutical lane. Unfortunately, this industry is highly specialized. It's labor intensive. And we have to remember that unlike other industries, we just can't automate what we do by putting in a kiosk to take your order. We need people. We can't reduce the size of the package of the serving of the ice cream container to control our costs while keeping price the same. And we can't close on Monday or Tuesday. We need to be there 24/7, 365. I understand the challenges of affordability, and we look at that as in a balance of access, quality, and doing the right things for our community. And I can certainly and confidently say that part of our examination of expense and expense control allows us to come in at some of these historically low rates that have been at times below inflation.
Mike, I'd like to just jump in on this one. Dr. Dobson talked before about the need for services, and if people can't get that in our local communities, they'll need to go somewhere else, whether that's out of state or somewhere a long distance from where they live. Whether these budgets are approved or not, those healthcare needs are not going to go away, or people aren't miraculously going to the needs that they have for those services aren't miraculously just going to disappear. So they're going to have to get them somewhere. I think the answer is that we need to continue investing in the future. We need to continue investing in programs and policies that drive change in regard to population health. We need to invest in these programs that are going to help us interact with our communities, community members proactively, so that we can help them stay healthy, so that down the road we can help them avoid these more costly healthcare interventions. I think that's the recipe for success and what we need to consider going forward. But the needs of the population are not going to just miraculously vaporize because a budget's not approved.
Thank you, Dan, and Howard. Thank you for the question. We're just about at 10:45. I think we have time for one more question if there's one on the field.
Can I just reply real quick, Mike? I'll be fast.
Oh, sure, certainly, Dr. Dobson. You're fine.
Howard, first off, I have to tell you, 100% agree with you. In fact, everyone on this panel agrees with you. We can't afford, as Vermonters, to continue to have increasing costs. But these budgets are addressing basic services. Where we have to focus our efforts is high dollar expenses like the pharmaceutical costs that Dr. Leffler referred to, and end of life care. And frankly, that can't just come from our hospitals. That has to be movements that are outside of our system and focused on. We could probably reduce, the estimates are about 12% of cost if we look at end of life care and improving that. I think it's much higher than that. Being a bedside emergency physician, I think we're approaching 18 to 20%. That is a much, much bigger number of savings that would actually level or even decrease costs for Vermonters. And that's the type of initiatives I'd like to see moving forward.
Thank you, Dr. Dobson. So now we're at 10:45. So we'll round this out by saying thank you to the my colleagues that were here today. Thanks for the for the media being available to listen in. We really appreciate that, and we look forward to moving forward and having our conversations with the Green Mountain Care Board over the next several weeks. Thank you.